Good morning, everyone. Today is Thursday, March 1st. Thank you for joining in to our weekly healthcare reform webinars. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. And weekly, we run these webinars as a resource to our agent partners or any agents in the industry that feel it's their obligation to stay informed, to be the true consultants they can be to their clients. So I appreciate everyone joining in. We do have some new folks on the call today, so just want to let you know how you can ask questions, and questions are certainly encouraged. You can either raise your hand icon, which is in the control panel to the right of your screen, or you can type in your question in the question box and I'll answer that at the end of the webinar. So just with a show of your electronic hands, if you can hear me and see my screen okay, that would be great. Thank you. I see your electronic hands. Great. Okay, so let's get started with the agenda. So with President Trump's administration, I talked a little bit the last couple of weeks about Idaho filing for non-ACA plans for 2019. They did have an executive order from their governor, and they're now saying as soon as April of this year, BlueCross of Idaho is planning on making new non-ACA plans available for sale. So to me, that sounds pretty darn exciting. Certainly in Pennsylvania, we don't have an executive order, and I certainly don't expect one. But it is encouraging that the Blues, who of course are a national association, are thinking outside the box, and hopefully this is just, the start of some good things, some, really relief for these individuals and families that are in the individual market. So I choose to think that is good news. More good news, 20 states have filed a lawsuit. They filed it on Monday, claiming that the ACA law is now unconstitutional because the tax penalty was eliminated. And they're making the point that in 2012, the Supreme Court ruled 5-4 that Obamacare's individual mandate was constitutional because Congress has the power to levy taxes. And the premise of their lawsuit is that without that tax penalty, Congress is left with a mandate in which they're required to enforce, but they're unable to exercise their taxing power to actually enforce it. And it also goes on to say that the lawsuit, that the core provision with that you have to have qualified coverage or you have a tax penalty is not severable from the rest of the ACA law. And that was also ruled back in 2012 by four of the Supreme Court justices. So that to me is pretty encouraging. At this point, and we'll go right into the next point, 2008 individual tax penalty still stands, and it is expected to be implemented. The change with the tax law that added that the individual tax penalty would be eliminated in 2019 is just that. In 2018, people are still required to have the qualified health plans in the ACA market, or they will get a tax penalty. So I think there's been some confusion on that, and I just wanted to make sure that that everyone was aware that the tax penalty does stand for this year. But all of these things are really chipping away at the foundation of this law, and of course, we're still expecting more executive orders to give carriers the latitude to create these non-ACA plans, hopefully less expensive. But, again, all of these things are pretty encouraging. So we talked too about JP Morgan Chase, Amazon, and Berkshire Hathaway forming an alliance to offer health insurance to their U.S. Employees. So it's gaining interest from other groups such as the Health Transformation Alliance, and that was formed in 2015. They have a few large company members, American Express, Macy's, Verizon, Caterpillar. Newer members include BNSF Railway, which is a subsidiary of Berkshire Hathaway. So, I guess everybody's in the pool together and the tentacles reach far, but this is going to be pretty interesting to see, just as, an exercise to see how this really shapes up with a company really fully taking on insuring their employees. They're going to be pushing a lot of telemedicine, is what I read. Certainly, they're going to be looking at the prescription costs and seeing how to lower those costs. But what they're saying is it's a whole new way of implementing insurance. They're profit neutral, so really it's just having the funds and the capital to, or the reserves to pay those claims, and certainly a lot would be based on wellness as well. So again, we'll keep watching it, but still not a whole lot of information out on it. There's a few other bills that have kind of resurfaced with the budget talks, and they were previously stalled, but the Alexander Murray bill, which would authorize the cost share reduction payments, that's back in the forefront, as well as the Collins high-risk pool funding. So we'll keep watching that as well, but that can be interesting to see how that shapes up. And then, of course, we talked last week about the new short-term medical proposed bill, which would eliminate the 89-day limit and allow for the coverage on these short-term medical, AKA skinny plans, to be issued for 364-day duration. There is a 60-day comment which ends April 23rd, and right here is the link for you if you choose to make a comment on the benefits or the troubles that could come from this. So again, if you feel you have something to say, go ahead and look at that link and make your comment. Just want to let you know too, NAHA, the National Association of Health Underwriters, meets every year in the Capitol, Washington, D.C. They are citizen lobbyists that go around and meet with legislators talking about issues that are important to us as health insurance agents, whether it's the individual market, the group market, or even the Medicare market. So that happened this week, and I did attach the NAHA Capitol Conference talking points. Some noteworthy information is they talked about the grace period for non-payment on the individuals, reducing that from 90 to 30 like everyone else, having tax credits used outside of the marketplace if fewer than 2 choices are offered in a state. Any person can purchase catastrophic coverage. And I mean, it goes on and on and on. There's talk about the 40-hour limit. Of course, it wouldn't be a Capitol conference if they didn't talk about that Cadillac tax and kicking that down the road even further. Medicare, they're talking about, modifying and suspending the requirement for the scope of appointments, allowing better counseling for beneficiaries. I mean, it just goes on and on. So there's a lot on the NAHU's agenda. And if you're not a member, it is an association that is made up of agents that benefits agents. And if you want any more information on that, you just let me know. But again, they are working hard on our behalf. And these are all things that you can bring back to your clients to let them know that you as a health insurance agent are taking an interest in and trying to make a difference for them. All right, so let's see what else we have here. Highmark Elite Producer Rewards, excuse me. An email is going to be sent. There's going to be a login and a link, and it's going to be sent within the next few weeks. It is a voluntary program. It's a program that if you are writing Highmark group business, dental, vision, a few other items, that you are assessed a point value, and that those points can be used to purchase things such as electronics, travel, purses, tools, everything that you really want. But it is something that Highmark is doing to give back to agents. It is only available for agents that work through an elite brokerage, and URL is an elite brokerage. But again, the link is going to be sent out in the next few weeks. Can't stress enough that it is voluntary. If you are assessed points, you will also you would be taxed on those points. So it's not a dollar for dollar, but you would get a 1099 based on the points. I just wanted you to be aware of that as well. When you get the link, that will be explained to you. Again, if you have any questions on that, let me know, but you will be getting some additional information in the next couple of weeks. Capital Blue Cross termination deadline is 5 business days. There are no exceptions to that. That is not our rule. We just, we can fight the good fight, but that's not something that we can get overturned. As much as we want to support you, our agent partners, in getting, things through that come in after that, we can't. It's a brick wall, and I want you to be aware that the termination deadline, 5 business days prior to the renewal, is firm, and Capital Blue Cross will not back out of that. So just be mindful of that. And let's see. Highmark, Blue Cross Blue Shield of Northeastern PA and Western PA, the HMO and HMO programs, some of the folks did not choose a primary care physician, so that form is also attached in case your clients have any questions on that. And then last but not least, before we open it up for questions, training opportunities, March 5th, we did mention this, 10 to 10:30 is the final expense first Monday's webinar. Matt Alina from our office is going to be running that webinar, and he does a really nice job. So I think whether you're in the individual market, group market, or definitely the Medicare market, I think you can listen in on that webinar. Again, it's 30 minutes, and maybe gain some ideas on how to expand your product offerings, or to even go back to your current clients and sell them final expense. So again, it's on our website. If you want the link, you can go to our website, or you can shoot me an email, and I'm happy to send you that registration link. And that's it. That brings us up to the open forum. Next webinar is next Thursday, March 8th, and I will be right back here. Hopefully you will be here to join us as well. So let's see questions. What do we have? Hopefully you guys can still hear me. Yes? Okay. There was a note that they couldn't hear me. There is a gentleman that asks, I've heard rumors that they are looking at changing when AEP actually occurs. That I've not heard, but that's something I can certainly check into, and I will get back to you on that, and also update everyone next week. And Jim asks, would you explain the CBC termination deadline? That's for group, Jim. And if they renew or have a renewal date, for example, of April 1st, they'd have to have that termination request, that written termination request to terminate that group April 1st, no later than 5 days prior to April 1st. I don't know what that date is. I don't know, 26th of March. So you go to the effective date, count back 5 days, and that is the absolute last day you can have that termination letter. Otherwise, they will not term, and they would have to go terminate for the following month. Mike says, any details on the short-term medical bill to search at your site listed? No, it's not, Mike, but I will send you that comment link, and you can get information from there. I'll also send some additional information. There was an article in my newsletter last week. I'll pull that as well. Let me just make myself some notes. I'm sorry, at least just also mentioned it's 5 business days, not actual days. So 5 business days prior to April 1st. If you want a group canceled for April 1st, that's when you would have to have the termination in, no later than that. Yes, Dave says, does CBC termination apply to mid-year terminations? Yes, absolutely. If you want it termed on a specific date, then you can't have that termination request in any later than 5 business days prior to that requested termination date. Okay, that looks like all of our questions. And as always, I truly appreciate you joining in every week. Please keep your questions coming, and if you have anything that you would like me to research or discuss in future webinars or next webinar, shoot me an email and let me know. I'm happy to discuss whatever you feel is going to help you in your daily sales lives. So as always, I appreciate everyone joining in. I wish you all a great balance of the week and a wonderful weekend. Bye-bye.